Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up, deep concern about the mosquito-borne Zika virus, which is likely coming to the U.S. and soon. This week, the CDC confirmed what's long been feared about the virus. Here's John with more.
The CDC said confirmation the Zika virus causes microcephaly, an underdeveloped brain at birth, is unprecedented. It's the first time in history a virus transmitted by mosquito bite has been found to cause birth defects. Dr. Sonia Rasmussen is with the CDC.
What we're learning is that they have a severe form of microcephaly that is oftentimes associated with other problems in the brain that can be seen on imaging, on CT scans or MRIs that make us really concerned.
The CDC says it made the determination based on mounting evidence from many studies. Images released by researchers in Brazil, where the virus is widespread, show severe brain damage in babies with microcephaly. The white areas are signs of calcium, felt to represent destruction, inflammation, and scarring in tissues of the nervous system. The researchers said the damage was extremely severe, indicating a poor prognosis for neurological function. Obstetrician Dr. Jennifer Wu is with Lenox Hill Hospital.
This is not something that will go away, and this is something they'll have to live with for the rest of their lives.
Researchers are just at the beginning of learning about the dangers of Zika infection.
Typically, we find out about the tip of the iceberg first, and then we learn more. Sometimes it takes years to understand the full spectrum.
John, health officials said this week that Zika is scarier than they first thought. So what does that mean for us?
Well, I'm very concerned about that. My colleagues are very concerned about that. And one of the concerns is, are we throwing everything we have at this virus, especially before the mosquitoes are actually upon us in full force? So time is of the essence. The resources have to be there in time. And one of the debates, you've heard about it, is that there's controversy over the fact that about 2 months ago, the White House requested nearly $2 billion from Congress to help fight the Zika virus. So far, those funds have not been allocated. So I went down to Washington and I spoke to some of our representatives, our legislators, including Congressman Tom Cole, who's a Republican from Oklahoma, who heads up an appropriations subcommittee that helps decide will the funds be allocated.
He guaranteed the money will be there.
It was very reassuring to me. He said, look, I get it. And I really felt, my impression was he does get it. He said, I guarantee you the money will be there, which is terrific news. And I have to say that I spoke to a senior public health official who said to me that, following my conversation with Tom Cole, and he said, yes, actually, talks are going along much better, and he is encouraged that the funds will be there.
Well, moving on, this week a government panel released its final recommendations for the daily use of aspirin to help prevent cardiovascular disease and colorectal cancer. So what are the recommendations?
Sure. Well, the recommendations are, of course, stirring the pot on this ongoing aspirin debate. Basically, the U.S. Preventative Services Task Force put out what they called final recommendations about the daily use of aspirin for preventing disease. So specifically, people between the ages of 50 and 59 who are at an increased risk of heart attack, stroke, or colon cancer may benefit. They may be able to lower those risks by taking a daily low-dose aspirin. The task force also said for people between the ages of 60 and 69, they may also benefit, but they need to talk about that with their doctor first. For groups of people under the age of 50 and over the age of 69, there wasn't enough evidence to make clear recommendations either way.
Holly, there are serious risks to aspirin use, though. So how do doctors determine whether the benefits outweigh those risks?
Sure, very much so. The main risks really have to do with bleeding in the GI tract, particularly the stomach. And these recommendations apply to really three groups of people. The first group is people who are not at increased risk of bleeding for any other reason. The second group is people who have at least a 10-year life expectancy, and also those who are willing to take aspirin daily for 10 years. Now, there's a balance, though, because people who are, for instance, at a lower risk of heart disease may not benefit as much from taking aspirin, but still the risks from taking aspirin are there. So, you really have to make sure that that balance goes in the right way, that the risks don't actually outweigh the benefits.
All right, finally this morning, we have an update to a story we told you about nearly 2 years ago in Morning Rounds. A quadriplegic man is able to move his hands again. Thanks to groundbreaking technology, this first-of-its-kind system uses the paralyzed patient's brain waves to move his own muscles. CBS News' Adriana Diaz spoke with the pioneering patient Ian Burkhart about his experience.
I'm most excited about the movements that are just everyday movements in life. Picking up a cup and pouring it into something else, or picking up a credit card and swiping it through a credit card reader.
Does it weird you out at all that a computer is essentially reading your mind?
No, I'm just glad they can find something up there.
All the things we take for granted.
Absolutely incredible.
Can you imagine what's around the corner, what this could mean for people who've had strokes, other neurological problems? We take this for granted, right?
Yes. Yeah.
I mean, you have to really appreciate
This
that.
is clearly just the tip of the iceberg. It's just all upside from here.
It's so exciting. So exciting.
All right, Drs. Jon LaPook and Holly Phillips, thank you both so much.